in the brain which contains blood. At the bottom of the page, the pathologist had written, "No evidence of child abuse." Iowa's medical examiner was alarmed.
The autopsy mentioned having 2 fairly fresh subdural hematomas, blood clots around the brain putting pressure on the brain. 2 distinct ones. He called them recent clotted blood, but there was no evidence of healing in this case. So he found a finding that is abnormal.
Dr. Bennett did a little investigating of his own and discovered that before Morgan died, her doctors noticed retinal hemorrhages, bleeding in the back of her eyes. This told Dr. Bennett that Morgan's airway might have been obstructed purposely when someone was trying to cause unconsciousness. Dr. Bennett did not believe that Morgan's death was of unknown origin. He was convinced it was murder.
The retinal hemorrhages and subdural hematomas came from trauma, specifically the violent shaking of the shaken baby syndrome.
Once those words of shaken baby are spoken as the cause of death, there's no doubt it's a homicide.
Because of Morgan's death, prosecutors in Iowa now feared that Michael's life was in danger. Michael had been hospitalized 18 times in 3 different states. His sister Morgan was hospitalized 20 times before she died. Every single episode noted Tanya's claim that she performed mouth-to-mouth resuscitation before emergency personnel arrived. No one but Tanya had ever witnessed the onset of a seizure or breathing problem in either child.
We literally papered the office wall with flowcharts and timelines so we could look for this pattern that eventually resulted.
Prosecutors searched the medical literature and discovered some common elements among those suspected of Munchausen syndrome by proxy. Most are women. They demand more and more tests and second opinions even after nothing has been found. The child's illness does not occur when in daycare or with a babysitter. There's a family history of other siblings with the same problem or an unexplained sibling death. Suspects have an emotionally distant relationship with their spouse. 1/3 are in the medical field, mostly nurses. The profile was a remarkable portrait of Tanya Reed, including the fact she was a nurse.
And that's not really a surprise, because if you were going to go to a physician and make up something about your child, if you knew nothing about medicine whatsoever, it's going to be harder to make any kind of a convincing story.